Welcome to Yahoo Finance. I'm Kristen Myers, and this is 2020, a time for change. Well, Democrats have kept healthcare in focus this week as the Senate holds hearings for Supreme Court nominee Amy Coney Barrett. A Supreme Court case on the Affordable Care Act, also known as ACA, is upcoming, and many fear that her appointment will put it in jeopardy. Now, experts estimate that repealing Obamacare would cause over 20 million Americans to lose their health care coverage and would only worsen racial disparities. According to the Center on Budget and Policy Priorities, the uninsured rate for Black Americans would nearly double to 20% and increase to 31% for Hispanics. So we're now joined by Dr. Patrice Harris, the immediate past president of the American Medical Association, the largest association of doctors and medical students in the country. As always, Sibyl Marcellus and Jen Rogers are also here for today's conversation. So Dr. Harris, as I was just mentioning some of those numbers on the impact of repealing Obamacare on Black and Hispanic communities, Republicans are saying right now that they will create something better than the Affordable Care Act. Wondering what your biggest worry here as a health provider, as someone in leadership at the AMA, with an appointment of Amy Coney Barrett on the bench.
Well, there is no question that people without health insurance live sicker and die younger. And here in the South, where I live, a significant number of folks without health insurance are, of course, from Black and Brown communities. Pre-COVID, we had a disproportionate burden of chronic disease and lack of access to health care, and that has just been brought into further stark reality with COVID. And the AMA supported the Affordable Care Act, and we continue to support the Affordable Care Act, and we believe the best path forward is to build on the progress of the Affordable Care Act to make sure that everyone has access to affordable, meaningful health coverage.
Now, speaking of the coronavirus pandemic, as we've all been talking about, it's only highlighting racial disparities. It did not create them. As we're looking ahead for hopefully an aftermath of this pandemic, what needs to be done to improve, healthcare and access to healthcare, and also those health outcomes for those minority communities? Is it increasing Black providers of healthcare? Is it increasing hospitals in minority communities? I mean, what do we need to be working on now and going forward to really make sure that we have equitable access for everyone when it comes to healthcare?
So, the answer is all of the above and more. As I've talked to so many folks over the last couple of months, there is no question that we have to have an all of society approach here. Of course, we need everyone to have access to affordable, meaningful health insurance. We also need to increase the diversity of the physician workforce. As I said in my inauguration, we need to make sure that the faces of physicians match the faces of patients, but not, just as a checkbox. We know there's some data and some studies to support that Black men, for example, take the recommendations of Black physicians. We know that sometimes Black women feel listened to, and really other community members feel listened to by physicians who look like them. But of course, we also have to look at those upstream determinants of health. We cannot forget, again, as you note, that this is not a new phenomenon, and we need to look at issues such as structural racism, unconscious implicit biases, policies such as past lending practices that were discriminatory. All of these issues, and transportation and access to healthy food, all of these issues need to be addressed if we really want to move towards health equity.
The country has been paying close attention to the Supreme Court confirmation hearings, and there's been a lot of talk about possibly Obamacare being taken away from Americans in the middle of a pandemic. As a physician, what have you seen from people? Are they worried that their health care could be taken away as we're dealing with the pandemic?
I would say really healthcare has been on the minds of everyone in this country, really, over the last couple of years, you saw folks really activate when they thought that the Affordable Care Act might be repealed several years ago. You saw folks advocate and activate around the 2018 elections. And listen, that is what we need to continue to have. I always say, conversations about the best path forward for healthcare should happen in a democracy, and we should have fair-minded debates about that. I can tell you, as a psychiatrist, I know that so many more patients had access to coverage for substance use disorders based on health exchanges and expansion of Medicaid. So I see a lot of worry about repealing or replacing or declaring the Affordable Care Act unconstitutional. Again, the AMA has been activated as well. Because we do believe that we should, again, build on the progress made with the Affordable Care Act, as opposed to moving back and taking away health insurance from so many who have gained access to better care.
Dr. Harris, the coronavirus has only brought into stark relief some of the disparities that we have in this country over healthcare. I want to ask you about breast cancer, because it's Breast Cancer Awareness Month, and about 1 in 8 women in the U.S. will develop invasive breast cancer over the course of their lifetimes. But Black women, although they're less likely to develop it, are 40% more likely to die from it than white women. That's according to the CDC. And I think it points to an issue overall in healthcare. It's a real a 1-2 punch that Black women face racism and also sexism. So do you see solutions out there for this issue?
Well, again, we want to make sure that Black women have access to mammograms so they can be screened early on, because as you state, it's not so much that the incidence is greater, but we are certainly dying in greater numbers from breast cancer. And one reason, and it's always complicated, but one reason is the time of diagnosis, getting diagnosed later on in the course of the disease. And so we have to make sure that everyone has access to healthcare so that they can get in early. Have a usual source of care, make sure they are having preventative care. And by the way, we don't talk about this enough, but prevention and preventative services were covered in the Affordable Care Act. So again, for so many reasons, and many of those reasons impact Black and Brown communities, or many of those reasons are important to Black and Brown communities, we certainly need to make sure everyone has access to this coverage.
So picking up on that, and Dr. Harris, you mentioned some of those things about health outcomes and how they improve when essentially patients have doctors that look like them. And I've been talking to a lot of my friends who are currently in residency just about all of the hurdles that students face, but particularly students of color, to get through medical school, get through residency. Wondering from your perspective, what needs to happen either at the level of medical school, at the level of residency, or perhaps even sooner, to really make sure that we are increasing the number of minority healthcare providers?
Well, I'm a child psychiatrist, and it probably won't surprise you to hear me say that I think that we really need to start early if we want to make sure there are solid foundations for learning, right? Even in early childhood education, we need to have those solid foundations for learning, because oftentimes what happens early on in school dictates how far our students will go. Now, we also have to make sure that our schools are adequately funded and adequately resourced. We have to look at issues around school discipline. There have been some studies that show that Black boys in particular are disciplined more, perhaps referred for more punitive measures more often. But again, so we really have to start early on and look at all of these issues in the pipeline. Of course, as we get further along, I know programs like they have at the Morehouse School of Medicine here in Atlanta, where I am, these pipeline programs, again, where we connect with children and young students in junior high and high school, really all along the way, undergraduate, and even in medical school, because, just because you may not have done so well on the entrance exam doesn't mean you won't succeed in medical school. And I know that Dr. Valerie Montgomery Rice and all of her colleagues over at Morehouse are demonstrating success in many of these pipeline programs. So we have to start early, and we have to make sure there is support for student success all along the way, because it is a long journey to become a physician, no question. Well worth it, in my opinion, but a very long journey. And we need to make sure we are nurturing students to do that. Just quickly, one of the reasons I was just so proud, many reasons of my accomplishment as the first African-American woman president of the AMA, is I could be evidence, tangible evidence that you certainly can aspire to become a physician and even aspire to leadership positions in organized medicine. And it's important because we know that a diverse workforce means better health outcomes.
All right. Well, I wish we had so much more time, but we'll have to leave that conversation there. Dr. Patrice Harris, immediate past president, and as she reminded us, the first Black female president of the American Medical Association. Thank you so much for joining us today.
Thank you for having me.
Well, coming up after the break, we're going to keep the conversation on healthcare, and we'll be chatting with the co-founder of Big Apple Urgent Care. That's next.
Welcome back to 2020, A Time for Change. I'm Sabile Marcellus. Nearly 900,000 Americans lost their jobs and filed for unemployment in just the past week, as we're seeing more layoffs take place. According to banking giant UBS, the economy is transitioning from hiring by companies with a future to firing by companies in decline. Joining us now is Dr. Tamara Moise, who's an emergency room physician and the co-founder of Big Apple Urgent Care in Brooklyn, New York. Dr. Moise, you're uniquely positioned to assess the financial toll of the coronavirus pandemic as both a doctor and a small business owner. In your area in New York, Governor Cuomo recently reimposed shutdowns on parts of Queens and Brooklyn because of a spike in coronavirus cases. The World Health Organization recently came out and said that massive lockdowns should be avoided if possible because they're so punishing on communities. Now, my question to you is President Trump right in asserting over and over again that the cure can't be worse than the problem itself?
So thank you so much for having me. So of course, the whole issue of shutdown, versus health, life, and death, it's a very complicated issue. I definitely feel that creating a balance is the best way to approach the whole situation. Unfortunately, our numbers here in New York are going back up, and we're we're a city of over 8 million people, so there has to be some kind of lockdown. So I'm just hoping, and I do trust that the governor will come up with a solution where we're not fully on lockdown, because just like you said, a lot of people are losing their jobs, and just coming to health is wealth. If you're losing your job, you're not able to take care of your family, you're not able to get proper health care too, because you have to remember these people are also, if they're losing their jobs, they're losing their health plans as well. So I just think that, we definitely just need to find as much of a middle ground as possible, so that our health is being taken into consideration, that we're reducing the number of deaths, but at the same time, we're not completely shutting down. And of course, the important way to make this all happen is for us to actually follow the rules. The fact that wearing masks, we've been at this point told that masks can even be more effective than a cure. So following the rules, wearing masks, especially in a crowded environment like New York City, it helps to really keep the numbers down and keep the number of deaths down. And the more that we do that, the more that we could keep our businesses open. That's what people don't realize. So I'm just hoping that as citizens, we're listening to the science and that we're actually wearing our masks, social distancing, avoiding large gatherings as much as possible, because our behavior is going to affect everything.
Well, speaking of following the rules, we're in the middle of a presidential race, which is obviously very contentious. Now, Vice presidential candidate Kamala Harris canceled all events having to do with campaign through Sunday because, and this is after her communications director tested positive for the coronavirus. Now, Dr. Moise, what steps should the campaign take to protect presidential candidate Joe Biden?
I've been following what the Biden campaign has been doing to protect themselves from the coronavirus. I think they've been doing a phenomenal job. For example, for Kamala to go into the debate with the vice president and to make sure that there were the dividers up, this was very helpful. So I really feel like they're taking all the steps that they can to make sure that they're not spreading the virus to anyone, protecting themselves from getting it, because obviously we need them. They're running for office, and we need them to be here and healthy. So I actually think that they are following the science. They are following what Dr. Fauci is saying. They are following all of these rules. So I don't even think I have to give them advice, because I think they know what they're doing already. The fact that Kamala made that decision to to cancel this event, we still can do everything via video, and the message will still be heard. So I think the Biden campaign is doing a phenomenal job in terms of being able to run their campaign, but at the same time still, protect themselves and protect other people and keep everyone safe.
Dr. Moise, the pandemic has really shown us a lot of the inequality that has been here for decades, centuries in terms of healthcare. As we discussed with Dr. Harris, I mean, every day people of color are also, they're more likely to die, not just, in coronavirus as we've covered, but just common and chronic health problems. And as somebody that works in the urgent care area, I'm curious, because urgent care has kind of become people's like regular internist now. Do you think that we need to change some of the economic incentives in healthcare in terms of the first person that you go see, that relationship has devolved, and that's someplace that we should put some muscle behind?
So I think you're bringing up a great point. So I'm an emergency room physician, and I'm also an urgent care owner. So I've been able to take care of patients in both settings, which is very interesting, especially in the coronavirus epidemic. So I think that, well, first of all, uh, when the numbers of death were really high in New York, I experienced a large amount of, well, basically a large increase of patients coming to the urgent care, because, like you said, they are starting to come to us. So it was really interesting at that time, because the message was to not go to the hospital at a certain point. That was like in March, April. And people were afraid to go to the hospital because they know there were a lot of COVID patients. So they were coming to the urgent care. So the interesting part of it was that some of these patients were actually critically ill and actually needed to go to the emergency room, but they came to us first. So, as a result, we had to make sure that we had to up our supplies. We had to make sure that we had to quickly get more oxygen tanks, because people were coming and gasping for air. And I was that liaison to hold them up and to hold their life up until 911 was called and the ambulance can bring them to the emergency room. So it was really an interesting time. So a lot of dynamics are changing with healthcare in terms of everyone coming to the urgent care. But luckily, like at Big Apple Urgent Care, we're in East Flatbush, Brooklyn, and we're able to, because we're emergency room trained, we know who belongs there and who belongs at the urgent care and who could be treated and sent home versus the person that is severely ill who needs to go to the emergency room. And just to address the inequities that you were speaking about earlier, um, for example, in East Flatbush, this is a working class community, is predominantly Caribbean, Black and Brown community. So we uh, we are experiencing a lot of inequities there. We had quite a high percentage of deaths occurred in in this zip code and some of the surrounding zip codes of Black and Brown communities in Brooklyn and Queens and the Bronx. So and the reason for that is the inequities that you talk about. If there's inadequate housing, if you're in a food desert, so these are some of the things that we're dealing with in my neighborhood, you're going to be susceptible to getting deadly diseases. So if you're in a food desert, you don't have access to healthy food, you easily become obese. And a lot of obese patients don't do well with COVID. A lot of obese patients, they fight for their lives for COVID. So these are some of the challenges that we're dealing with in the urgent care in Brooklyn. But of course, everyone deserves high quality care. So we're doing our very best at the urgent care to provide that, despite all of the challenges that are happening around us.
Well, it's great to have your insight as we continue to deal with the ongoing pandemic and its effects. Dr. Moise, co-founder Big Apple Urgent Care in Brooklyn, New York, thanks so much.
Thanks for having me again.
Coming up, we'll talk about corporate America and how they're being held to account, being kept accountable for the promises they already made.
Welcome back to 2020, A Time for Change. I'm Jen Rogers, and we've just been talking with two doctors here on this show. And what stands out to me, and my co-hosts Sabeel Marcellus and Krista Myers are both here, is how complicated this issue is. And there's like little parts you think, okay, we can knock this off. We just had our last doctor talking about a food desert, or Dr. Harris talking about doctors that look like you. But there's so many issues here. You kind of want to try and figure out a way to simplify it. It's really complicated, Sabeel.
That's right. Dr. Moise was just saying there, she's a doctor and she's a small business owner. And it's hard to kind of figure out what's better, a shutdown to stop the spread or keep it open. But then there's a possibility of a spike. So it looks like we're still dealing with that issue as the pandemic is ongoing and we're waiting for a vaccine.
Hey, Kristen, I know you were really focused earlier when we were talking just about how to get through medical school. Dr. Harris had interesting answers on that. I mean, it is a big issue for people.
Yeah, so this is something that I talk about a lot. I have a lot of friends right now that have gone through medical school, that are currently in residency, that are in their fellowship, and they talk to me all the time, essentially not just how difficult it was to get into medical school, to get through medical school, and now they're in residency and they're facing even more hurdles, even more obstacles. There's economic costs associated with being a resident. You are a paid physician. You, of course, are not making that big doctor salary that everyone thinks about when they think about doctors. And it is particularly difficult, for doctors of color that perhaps already coming into it already were behind when it came to economics and finances, that have to support their friends and their families mainly. And so it's really difficult to become a doctor in this country. And we're finding that less minorities are able to do it and able to get through because of all of those hurdles. And that is impacting patients on the back end right now. But we, unfortunately, will have to leave that conversation there. Thank you all so much for tuning in and watching. Be sure to stick with us and watch Yahoo Finance next week for our next episode of 2020, A Time for Change.